Hello. In this video, we are going to learn about behavioral treatment for autism, sometimes called behavioral intervention. Behavioral treatment is the most effective approach to helping children with autism, and for children who may be showing signs of autism, but who have not had a diagnosis. Behavioral treatment is based on the science of applied behavior analysis, or ABA. When it comes to autism treatment, you will hear the term ABA quite often. You will also hear the term evidence-based treatment. An evidence-based treatment is one that scientific research has shown to work. If someone is advising you to use a treatment that is not based on ABA, ask them to show you the scientific evidence that that treatment works. Even when well-intended, stories about what worked for a friend or a neighbor do not have scientific evidence. Behavioral intervention using ABA is an evidence-based treatment. That's because scientific studies have consistently shown that behavioral intervention works for most children with autism, even infants and toddlers. Children with autism may also benefit from other evidence-based therapies, such as speech therapy and occupational therapy. Behavioral intervention is recommended by the American Academy of Pediatrics and the United States Surgeon General as the best treatment for autism. Behavioral treatment is widely accepted among healthcare professionals and is used in many schools. There is no evidence that any other treatment can reliably help reduce the symptoms of autism. In toddlers and preschool-aged children, intensive behavioral intervention can sometimes eliminate the symptoms of autism completely. Behavioral therapy should be delivered by a licensed behavioral therapist. However, the behavioral approach can be used by any parent or caregiver. Later in this program, you're going to learn about specific behavioral intervention skills and see demonstrations to help you put them into practice. If an MChat screen has indicated your child is at risk, or if your kiddo has an autism diagnosis, immediately get in touch with your doctor or nurse about behavioral services. If your child is under 3 years of age, you can get help from your local early intervention agency. Programs are available in every state and territory. These publicly funded programs provide services for free or at a reduced cost for any child who is eligible. Your doctor or nurse should be able to direct you to an early intervention agency in your area. You can also find a list of early intervention agencies by state at the CDC website in the Learn the Signs, Act Early section, or simply Google early intervention agencies near me. A doctor's referral is not necessary to contact or to begin services at an early intervention agency. Tell them, I have concerns about my child's development and I would like to have my child evaluated to find out if he or she is eligible for early intervention services. If your child is over 3 years of age, contact your local school system. To teach new skills to a child using behavioral intervention, the target skills are usually broken down into small, manageable steps. As the child learns each step, a more complex skill or step is introduced until the whole task, such as using a spoon, brushing teeth, or putting on a jacket, are mastered by the child. One of the most critical behavioral techniques used to teach new skills is positive reinforcement. Positive reinforcement means giving your child their preferred toy or activity immediately following the behavior that you want them to do. Positive reinforcement is used in behavioral treatments for autism because learning typically does not come easy for children with autism. So we need to motivate them to pay attention and to respond to instructions. Another important part of effective behavioral treatment is the number of learning opportunities. A good behavioral program will incorporate many opportunities for the child to practice the target skill in many different situations and with many different people. Finally, a good behavioral program will include parent and caregiver training to teach those close to the child how to support and practice the new skills. Later in this program, you're going to learn about specific behavioral intervention skills, and you will see demonstrations to help you put them into practice. Now, despite the overwhelming scientific evidence supporting behavioral treatment for autism, many parents choose to pursue other intervention methods for their children instead of or in addition to behavioral therapy. If you decide to investigate or pursue other options for your child, it is very important to thoroughly research the treatment to determine whether it is an evidence-based approach that can support its claims with scientific data, the way that behavioral interventions can. Research shows that the earlier your child can begin behavioral ABA treatment, even if you provide it yourself while waiting for access to a therapist, the better the outcomes will be for your child. So if you suspect your child may have autism, start using behavioral approaches immediately. Please don't wait to contact a qualified, licensed psychologist or an early intervention agency. And remember, the information in this program is not meant to diagnose or treat. It should not take the place of consultation with a qualified healthcare professional.